Hello and welcome. Today I will talk about burn. Introduction. Burn is a sudden injury that can happen to an individual. Burn can be defined as damage or destruction of the skin and the surrounding organs and tissues because of outer heat, electricity, or chemicals. There are many causes of burn, and the person must take care when dealing with the fire, electricity, chemicals, and radiations to prevent injury and death. If the person got to burn, the treatment is different from each type of burn, and each person must know the emergency management of each type of burn at home. The types of burn. The type of burn considered according to what cause of the burn, that there were many causes of burn, like burn can cause because of hot liquid called scald. Burn can be caused by radiation or sunburn. Burn caused by a rough surface called friction. Burn can be caused by chemicals, electrics, and dry hot objects. Degree and depth of burn. We have first degree superficial burn, second degree burn, partial thickness burn, third degree burn, full thickness burn. So we want to recognize the burn by sign and symptoms and by the degree of the burn. First degree burn, the affected side is only top layer of the skin that is damaged. It is epidermis. So the first degree symptoms: skin color is pink to red, slight swelling, skin is dry. Burn can be anywhere from tender to severe painful. The second degree of burn, it will be both layer of the skin, the epidermis and dermis. So the symptoms: the skin looks raw and is mottled, red in color, skin is moist, blisters contain clear fluid, severe to extreme pain. The third degree burn, it will be damaging the three layers: dermis, epidermis, and subcutaneous tissue, and the skin is pearly white, tan colored or charred. Skin is dry, leathery. Blood vessels and bones may be visible under the skin. Little or no pain, as a nerve ending are destroyed. Burn complication. Burn can have many complications according to the degree of burn and depth of the burn to the skin. The most common complication that person can face: the person may face shock due to severe damage and hypovolemic shock due to loss of fluid. Acute renal fluid can occur in severe damage to the skin and loss of fluid. Because burns affect the skin, which is first defense against germs, the person can get infection and sepsis. The person can be unable to move the burn site and can have severe pain with the psychology. So burn treatment. So we can treat the burn according to the degree of the depth of the injured site. The first degree or mild burn can be treated at home. First, we will cool the site of the burn at least 10 minutes. Apply burn ointment to the burn site after dryness of the site. Better not to move or cover the burn site, because the gauze and bandage can be sticky on the burn side and it will be painful. The person, if he is want to go out, better to cover it because to prevent infection. And if the person is having severe pain, he can take a painkiller medication. But if the person suffering from second to third degree of burn, better to take the person directly to the emergency for further treatment. And So there is an instruction to be considered with the burn. If the person suffering from the burn person must be away from the burn site, don't try to remove the clothes from the burn site. Don't apply any toothpaste, butter, or tomato sauce to the burn site. Don't stop cooling the burn area before 10 minutes. So in conclusion, the burn is very serious health problem if not treated properly, and the person who got burn needs support physically, psychological, and socially. Because of long treatment, may patient need rehabilitation, physical therapy, and long life assisted care. Thank you very much.